Happy Health Talk Thursday. Okay, y'all. So last time we talked about Jamie Foxx and his stroke and how 80% of strokes are preventable. How do you prevent stroke? One, we all know you have to get your annual exam to find out what are your numbers and what you need to improve upon. Number two, keep your blood pressure in check. For most people, blood pressure needs to be around 130/80, depending on your age. Three, if you have diabetes, keep your diabetes numbers within check. You want your A1C to be less than 7%. 80% of strokes are preventable, but in the 20% that are not preventable through everyday habits, and there's some kind of genetic component that causes the person to have weakened blood vessels, even in those cases, they may be prevented if you know your family's history. So if you know you have a family history of people who have had strokes, or you have a family history of people who have had some type of issue with weakened blood vessels, you report that to your doctor when they're gathering your family history, and their test that they can do to see if you have that condition as well is called an MRA test. And there's a procedure that's relatively simple. Most people go home the same day. That involves clipping and strengthening those blood vessels that are weakened, and this helps people from getting a stroke. All right, so Jamie Foxx is an example of someone who most likely did not put their health status as their first priority. We know from his books and interviews that he was a smoker, and smoking is one of the main risks for stroke. Smokers are 3 times more likely to stroke out than non-smokers. So he is an example of someone who the health situation could have been prevented. Thank God he's come away from it in a miraculous way, walking and talking just fine. So this week, let's talk about an example of someone who was very proactive in their health care, Anthony Anderson. Anthony Anderson is an avid diabetes advocate. He's very outspoken, and he's an example of what can happen when someone is proactive in their own health care, and you can not only change your life, but change the life of your entire lineage, from your parents to your children and grandchildren. So Anthony Anderson has been talking about diabetes probably for at least the last 10 years. Let's take a clip of his interview on The Breakfast Club a few years ago, and when he's talking about his experience with diabetes. Let's take a look.
It's no secret that I've been a type 2 diabetic for close to 21 years now. I was the first person diagnosed in my family with diabetes, then my mom, and then we found out my dad had diabetes. And unfortunately, my father was diagnosed late in life, but probably had diabetes over 20 years, undiagnosed. You know, as I look back in my mind's eye, I was like, the symptoms that I had when I had become diagnosed was everything that my father was living with as a kid. And I advise everybody to go to the doctor and just go to the doctor and get checked up. You know, we take our car to the mechanic to get the oil changed every 3,000 miles, but we won't go to the doctor, to look at our internal fluids and see what's going on. And so it's laughable that we have to have a day called National Take Your Loved One to the Doctor Day. You know what I'm saying? I've gone to events like that. And,
That's like National Breathe Day.
Yeah.
Like everybody takes some air in.
Yeah, exactly. And it's really for the men in our community because, we rarely go to the doctor unless we have an appendage falling off.
So as you can see, Anthony Anderson is talking about his experience with diabetes and going back and looking at his symptoms that were very mild, not really noticeable, and thinking back to his father's symptoms, how he realizes his father probably had diabetes for more than 20 years. The way he explains it about his mother, he said his mother developed diabetes after he did, but in many of those cases, the person hasn't developed diabetes just then. They just found out that they had diabetes because they haven't been going to the doctor and being proactive with their health care. A lot of people go to the doctor just when they're sick and don't do the preventative care, their annual exams, getting their labs done. And so they don't even know that they have these conditions until they develop symptoms. And remember, once you have symptoms, you've already probably had the disease for decades. For most people, at least 10, 20, 30 years. So the point of the videos that I'm doing is to get everyone to be empowered in their healthcare, take their healthcare into their hands, go to get their annual exams and find out their numbers in order to stop the crisis situations like heart attack and stroke, in order to prevent the crisis situations like heart attack and stroke. And to illustrate the point of what Anthony Anderson was talking about, he was proactive in his own health care as the son, and he inspired his parents to become proactive in their health care. He probably saved their lives. And because of what he's doing, he's changed his own diet. Most likely he's changed the diet of his children, so that's affecting an entire lineage. Okay, y'all, that's it for this Health Talk Thursday. Y'all have a great day, and remember, be the light that you want to see in the world, and you already have everything you need within you.